Botulinum toxin, more commonly known as Botox, which we're pretty much familiar with now, is the most popular treatment that we do in our clinics by far. And I think it's been responsible for the tremendous growth and interest in the type of non-surgical approach to looking better, looking more youthful. Now, most people balk at the idea of having a lethal poison injected into them. The thing about Botox is that it's been around for 20 years. It was originally developed for treating little muscle spasms around the eyes here by a surgeon in the US. And patients were coming back and saying, yeah, my eyes aren't twitching, but hey, my wrinkles, look, you know, they're much better. And this, of course, triggered a tremendous interest. The company that makes Botox, of course, was highly interested in this development. And we now know that we can use it for treating frown lines and forehead lines as well as around here, and a little bit in the neck. The treatment involves a series of little injections using an incredibly fine needle. And for example, across here afterwards, immediately afterwards, there might be some little bumps that look like gnat bites, but within an hour or so they disappear. Otherwise, it's bruising may be a complication, particularly around the eyes here. And as I've said, if there's a technical problem, it could be slightly uneven. But in general, it's a lunchtime procedure. People come in, go out, and carry on as normal. There are some short-term problems that can occur, but mainly that's a technical issue where somebody's put in too much. You know, you might have a heaviness or not enough. It might be slightly out of balance. But there are no long-lasting side effects with Botox. We tend to start when people are showing signs of wrinkles, and that's usually around the eyes or in the frown here, in the 30s. Now, there are some people who have a genetic predisposition to developing wrinkles early. You know, they might have a very fair skin type and they've been bashing the sunbeds or been lying out in the sun a lot and they're wrinkling before they should do. And in exceptional circumstances, we might treat patients in their 20s, but mostly it's sort of 30s and upwards. So to find an expert in this area of surgery and medicine, the best way is through recommendations, so either a friend or a colleague who's had a treatment. If you're completely new to this and don't know anybody, then you need to take care and attention in finding someone. The best way, first of all, is to make sure that the doctor or the nurse is registered, and you can go to the GMC website, General Medical Council website, to check that out. There are several other associations of doctors and nurses that do these type of procedures. The most well-known is the British Association of Cosmetic Doctors, which represents about 300 doctors, similar to myself, who do these types of procedures. Then there's the British Association of Aesthetic Plastic Surgeons, who are based in London, who can give you information, but that's more surgically orientated. The other thing that is essential is that you check that the premises are registered under the Healthcare Commission, and you can check that on the Healthcare Commission website. And what that does is give you security that the premises are up to standard, that the practitioners are trained and continue to be updated, and also if you do have a problem, you have an area that you can complain through the Healthcare Commission to get some sort of satisfaction to your problem should it arise.